So for me, as a third year now, I feel like I've gotten training that's been incredible. I talked to some of my classmates and some of my colleagues and friends from around the U.S., and I think we have a very unique opportunity at UConn. Dr. Herbst is our ultrasound director, and she's probably the most passionate person I've ever seen for what she likes to do and what she loves to do. And she will teach you hands-on, and she will take time out of her day. At like 3 in the morning, she's responding to emails with, "This was a great ultrasound, this is how you could be better, this is what I see, what did you see?" And it's just unbelievable.
It's an amazing program. We have amazing staff. We get 2 weeks in intern year and 2 weeks in our second year. So more of the hands-on experience. You're there with ultrasound faculty who are very well trained, fellowship trained, and you have a bunch of scannership with them as well. That intern year, you get to have that chance to kind of just learn and absorb. And then that second year, when you're doing more of that teaching role, you're kind of applying and fortifying your knowledge. So it kind of like doubles your learning and your experience. If you can say passion personified, I think that would embody Dr. Megan Herbst. Again, great teaching, great faculty advisement.
And now that we have the butterflies too, we just take them everywhere, and we can use them at the sidelines of like special events, or we can use them in the ER and when we go to international health electives. I don't think any of my friends have gotten that type of experience.
Officers rotations, when you whip it out on ICU rotation, there's always a crowd that kind of just like gathers around you, and you're teaching all of the off-service residents and attending just new tricks, and so it's become a really big thing in our program.
Definitely been the stethoscope of our generation, and I feel like we've gotten a really unique opportunity here to use it, and use it, like Abu Bakr was saying, everywhere. And people love it, and even our attendings are like, "What do you see? What do you think we should do next?" And they're willing to take our input and our advice because they know how good our ultrasound training is. So it's been amazing.
How do you think ultrasound makes you a better emergency physician?
I mean, the real question is, how good of a physician are you if you're not using ultrasound? I think so you could be, a good physician, and ultrasound is only going to make you better. You could be the smartest person. You could be the smartest physician there is, but disease processes don't follow the textbook all the time. And so something could present classically as a pulmonary embolism, and then you take a look at the ultrasound, and sure enough, it's a pericardial effusion with tamponade. And I see this happening every day. There's an amazing amount of pathology that comes through Hartford Hospital. You've got blunt trauma, you've got penetrating trauma, and then you got super, super sick patients. You've got affluent patients, you've got poor patients who don't have the resources, all juxtaposed in Connecticut, in Hartford especially. Accessibility to machine, we've got multiple machines. We also have butterflies that residents can hold in their pocket, butterflyiq units, and so they're always encouraged to scan. They've got accessibility to scan, and then the scans are reviewed, they get feedback, they improve. We have a 2-day boot camp that is all day, and all of our first years go through that, but we also recruit our second and third year residents to teach it. That last 2.5 years or so, I've been at the medical school, and there are over 400 medical students who are very eager to learn ultrasound. We've incorporated near peer teaching, which the students love and the residents love, and I couldn't ask for better teachers than our residents. They're super enthusiastic. So we've got groups of students that are about 20 to 30 students all at once, and then we get 10 residents, sometimes even more, to help out with the teaching. And it's a very small student to resident ratio. Students love it. A 4-year curriculum with us, and yeah, it's been incredibly successful. The Center for Education, Simulation and Innovation, or SESI, is amazing. Any outside person who hasn't seen it sees it and their jaw drops. I mean, it's incredible. This space is incredible. We've got phantoms of every sort. I have a lot of pride for our program, for our faculty.
It's the next best thing to X-ray vision, so to speak. So portable, easy to use at the bedside, fairly quick to obtain, in the appropriate setting. And it definitely helps with sometimes identifying pathology, but at the very least narrowing the differential.
I think the fact that we have it set up so that the residents are encouraged to use ultrasound throughout their shift, throughout their residency training, helps a lot with it. It's available in all of our departments. Use it, and they are able to use the bedside both for educational purposes and to help make diagnoses.
I came in with zero experience and I feel like I got set up for success early in the program. What do you think?
I feel like ultrasound is very heavily emphasized here,
Yeah.
and it's very helpful because using it bedside could really cut down your differential and help you out, so I appreciate that. It also, like in terms of efficiency, can help you out as well. Just to think about like what your tools are versus having to always consider other imaging that can prolong patients' length of stay.
Anything else you want to add? Any other thoughts?
Dr. Herbst is amazing.
I'll second that. All of the ultrasound faculty are amazing. They know so many things.